Hello everyone. Today we'll discuss about the anatomy of the scalp. In the last class we discussed about the norma verticalis. So today we will deal with this scalp. So scalp is a soft tissue covering the cranial vault, as you can see here, and we are going to study it under following headings: definition, extent, what are the layers of scalp, blood supply, nerve supply, and the upper aspects. As I already told you, scalp is defined as a soft tissue covering the cranial vault. What is cranial vault? That we have discussed in norma verticalis, where you have seen, okay, 4 bones, 3 sutures, 2 points, and 1 highest point, 1 pair of parietal foramina. So it is soft tissue covering that part. And scalp has 5 layers. It has different layers there that we'll discuss. And coming to the extent of the scalp, anteriorly it is extended till the supraorbital margins or superciliary margins, posteriorly highest nuchal line on either side of the external occipital protuberance. On either side, superior temporal line limits the extent of the scalp. And forehead is the region which is common to both scalp and face. You can say forehead has less hairs compared to the scalp, other part of the scalp. So layers are 5 layers: skin, connective tissue, aponeurosis, loose areolar tissue, and pericranium. And you can remember these 5 layers by the first letter of their name. You can say S for skin, C for connective tissue, A for aponeurosis, L for loose connective tissue, P for pericranium. First we will see the skin. Skin here, it is thin skin, that is hairy skin. As I told you here, it is thin but appears thick, because when you pick the skin just above your eyebrows, it appears thick because it is firmly adherent to underlying second and third layer. So whenever you pick the scalp, you are picking the first 3 layers: skin, connective tissue, and aponeurosis. The gap you feel is that is loose areolar tissue. You can do that. Just pick the skin above your eyebrows, and you can see skin contains hair and sebaceous glands, and it is tethered to the underlying 2 layers, connective tissue and aponeurosis. That's why it feels thick, but it is thin and hairy skin it contains. You can see here the skin is having this all epidermis and dermis and hypodermis with hairs. And connective tissue. Connective tissue here is fibrofatty tissue containing blood vessels and nerves. Here it has fibrofatty septas filled with fat locules containing the nerves and vessels. It is a highly vascular layer. It is a highly vascular layer or connective tissue layer, and any injury will cause profuse bleeding here. That is a disadvantage. Advantage is the rapid healing. It will heal very fast because of this rich vasculature. That is about the connective tissue. Then aponeurosis. Aponeurosis is here called as epicranial aponeurosis. It is attached to the 2 muscles, a pair of frontal belly, a pair of occipital belly, and skin and connective tissue are firmly tethered to it. I told you, whenever you pick the scalp, you are picking the first 3 layers. We call that as scalp proper. So here you have 2 muscles, anteriorly frontal belly, posteriorly occipital belly. They are paired. Frontal belly doesn't have any bony attachment, whereas occipital belly has attachment to the nuchal lines. You can see here, occipital belly takes origin from the lateral part of the nuchal line. On the left side you can see the 2 bellies, occipital bellies, are separated. They take origin from nuchal line attached to epicranial aponeurosis, whereas frontal belly, they are together and they come from skin and insert into the aponeurosis. Frontal belly does not have any bony limitations here. So scalp, the first 3 layers here, they don't have any bony attachment anteriorly, whereas occipital belly has a bony attachment. So here scalp has a bony limitation that you can remember. That will make you to understand the phenomenon of black eye in the other slides. Loose areolar tissue. The name itself says it is loose. I told you how you can feel is just pick your scalp. The gap you feel between the bones and your finger, that is the loose areolar tissue. It separates the aponeurosis from pericranium, not tethered to above 3 layers, and contains emissary veins. So what are emissary veins? We have discussed. I told you skull has numerous small foramina through which emissary veins communicate extracranial veins with intracranial veins. Advantage is they help in regulation of intracranial pressure. Disadvantage is they help in spread of infection. Then last layer is pericranium. That is, it is loosely attached to underlying bones but firmly attached to sutures. And across suture it connects to endocranium. That is the layer covering the bones. That is the last layer of the scalp. That is pericranium here. And as I told you here, the skin, connective tissue and aponeurosis are tethered together. And when you see the aponeurosis here, it has two bellies. You can see anteriorly frontalis, posteriorly occipitalis. In between them you have aponeurosis. So both these frontal belly and occipital belly, they are derived from second pharyngeal arch. They are the facial muscles. So they are supplied by the facial nerve, motor branches of facial nerve. You can see here, any injured scalp will produce gaping because of the pull of these muscles here. I told you scalp proper consists of the upper three layers, skin, connective tissue and aponeurosis. And any injury here produces gaping because the frontalis muscle will pull anteriorly, occipitalis will pull posteriorly. That aponeurosis will be pulled across and produce gaping injuries, resulting in profuse bleeding. You can see there, and you can see the gaping injury here. It produces gaping. You can just see here, laceration or any wounds produce gaping here because of the contraction of the frontal and occipital bellies. And as you go here below, the loose connective tissue, it contains the emissary veins connecting the extracranial veins with the intracranial veins. I told you while discussing Norma verticalis, pair of parietal foramina contains the emissary vein which connect the superior sagittal sinus with the veins of the scalp and help in spreading of the infection that we already discussed. So because of these emissary veins, this loose connective tissue is called as dangerous layer of the scalp, because these emissary veins help in the spread of infection from outside to inside and inside to outside. And I told you any injury here may cause bleeding, and the blood will seep under the three layers, upper three layers, and anteriorly, and produces the black eye phenomenon because frontal belly doesn't have any bony attachment anteriorly. Now coming to the last layer, that is pericranium. It is the layer which covers the bones, and it is loosely attached to bones, but it is firmly attached to the sutures and attached to the inner layer called as endocranium across the suture. You can see. So these are the 5 layers. Coming to the blood supply, as we have already discussed, the scalp is highly vascular and these blood vessels lie in the connective tissue layer. Scalp is supplied by both by internal cavitary artery and external cavitary artery. Total 5 arteries supply here: supraorbital, supratrochlear, superficial temporal, postoauricular and occipital. Supraorbital and supratrochlear are branches of the ophthalmic artery, which is a branch of internal cavitary artery, whereas superficial temporal, postoauricular and occipital, they are the branches of external carotid artery. And coming to venous drainage, supratrochlear and supraorbital veins form angular vein, which join with the anterior region of retromandibular to form common facial vein. Superficial temporal vein will join with the maxillary vein to form retromandibular vein. Retromandibular vein will join with postoauricular vein to form external jugular vein, and occipital vein also drains to this jugular vein and finally drain into the brachiocephalic vein there, and this external jugular vein drains into subclavian vein and finally into brachiocephalic vein. Coming to nerve supply, scalp is richly innervated and it has 10 nerves, 8 sensory nerves and 2 motor nerves, and we divide the innervation of scalp into 2 parts, in front of the ear and behind the ear. In front of the ear it has 5 nerves, 4 sensory and 1 motor. 4 sensory are supraorbital and supratrochlear, branches of the ophthalmic division of trigeminal nerve. Zygomatic-temporal come from maxillary, auriculotemporal come from mandibular. So these branches of trigeminal nerve supplies the scalp in front of the ear, pre-auricular branches you can say, whereas the temporal branch of the facial nerve supplies the frontalis muscle here, and behind the ear, that is post-auricular branches. All the branches come from cervical plexus, just beneath the sternocleidomastoid muscle. You can see greater occipital nerve, lesser occipital nerve, third occipital nerve, and great auricular nerve. These all come from the cervical plexus. Motor supply, I told you, anteriorly, that is temporal branch of facial nerve supplies it, whereas behind the ear, the occipital belly is supplied by posterior auricular branch of facial nerve. So occipital and frontal are the facial muscles supplied by facial nerve. And here you can summarize the blood supply and nerve supply. There are 5 arteries supplying the scalp, 10 nerves supplying the scalp. You can divide them pre-auricular and post-auricular. And coming to lymphatic drainage, the pre-auricular part of the scalp drains into these pre-auricular lymph nodes, whereas post-auricular part of the scalp drains into occipital lymph nodes. And here you can see, as I already told you, blood supply is mainly by the 2 sets of systems of the arteries, that is external and internal. The external cavitary artery gives 3 branches, that is occipital, posterior auricular, and superficial temporal. They form rich anastomosis in the posterior part of the scalp, and also anterior part. Here you can see superficial temporal artery, and superficial temporal artery is commonly involved in temporal arteritis, joint cell arteritis, that you can see. It produces headaches and these vascular lesions, you can see there like that. So superficial temporal artery, posterior auricular artery, and occipital artery, these are the branches of external cavitary artery. They supply most of the scalp, you can see there, whereas the internal cavitary artery gives 2 branches via its ophthalmic branch, that you can see. Internal cavitary artery enters the skull. It does not give any branch in the neck, remember that. And it enters the skull via carotid canal in the form of a siphon and passing through the cavernous sinus, and there it gives the terminal branches. You can see supraorbital and supratrochlear are branches of ophthalmic artery, which is one of the terminal artery of the internal cavitary artery. So forehead is the site of rich anastomotic connections between internal and external carotid artery, you can see there. So the scalp is highly vascular, that you can understand here, and produces a lot of heat. And because of this rich blood supply, scalp laceration bleed profusely, and the gaping effect is because of the pull of both frontal and occipitalis muscle. And coming to the applied aspects, simply remember 5 layers. At least you remember 5 applied aspects, because each layer has its own features and own pathologies. Skin, as I already told you, it is thin, contains hair and sebaceous gland. It is more found for sebaceous cysts. Connect tissue contains blood vessels and nerves. Profuse bleeding. Disadvantage, what is the advantage? Rapid healing. Aponeurosis, gaping is there. Gaping due to pull of the muscles. You can see there, sebaceous cyst is there, like this. And you can see the bleeding scalp. Bleeding, and here bleeding is due to rich vasculature, and here gaping because of the pull of the muscles. And the phenomenon of black eye, I told you loose area tissue is called as dangerous area of the scalp, dangerous layer of the scalp, because collection of blood under the aponeurosis produces swelling, and blood slowly gravitates because frontal belly doesn't have any bony attachment. Then cephalohematoma, the collection of blood beneath pericranium is called as cephalohematoma, whereas collection of fluid due to any physiological collection there, that is called as caput succedaneum during the difficult labor due to contraction of the uterus on the fetal head, that is caput succedaneum. Thank you everyone. Please subscribe, like and comment your feedback.